Hi, my name is Dr. Ilya Skolnikov. I'm a diplomate of the International Board of Applied Kinesiology, and I'm the clinic director of Triadev Health Family Skincare Clinic. This is Yvette. We have Yvette here today helping us out for some demonstrations. We're going to be demonstrating the 5 or even 6 secret ways to diagnose and treat skin conditions that your dermatologist doesn't want you to know about. I promise you they don't want you to know about it, because if you know about it and you come in here, you will never want to ever see a dermatologist again. Why? Because they're just treating symptoms. They're not addressing the causes of your symptoms. They're just treating the skin without addressing how the skin got to be the way that it is. The skin is a reflection of what's going on in the inner parts of the body. So first, we got to have a language to communicate with the body with. We got to have a language that we can use to communicate with the body with. So in order to see if we're able to have proper communication with the body, we're going to check certain nutrients that allow for that proper communication to be established. So those nutrients are ribonucleic acid. So Yvette does not need ribonucleic acid. This is a way that we can check it. These are muscle tests that are general muscle tests. This is a strong indicator muscle, meaning when I pull down and Yvette resists, go ahead and resist, the muscle doesn't automatically get weak. If she says something she's congruent with, like say my name is Yvette,
My name is Yvette.
the muscle stays strong. If she says something she is incongruent with, like my name is George,
My name is George.
and Yvette's name is not George, so the muscle gets weak. It's almost funny, but not really that funny. So, and that can be really valuable for further insights into the body. Then we'll check parotid, and that muscle is getting weak with parotid, so she doesn't need parotid. And we'll check B12, she doesn't need B12. Okay. And nutritional deficiencies can lead to acne and other skin conditions like psoriasis and eczema. Okay. So we're going to check these 5 secret things that your dermatologist doesn't want you to ever know about. The first one's called ileocecal valve. I'm going to take a fist and I'm going to put the fist here on Yvette and see if the muscle weakens. It does not. Now I'm going to take a fist and put it here on Yvette to see if the muscle weakens to check bowels of Houston. It does not. So that's like one thing. Those are 2 areas of the digestive tract. This one's at the end of the small intestine where the large intestine meets. This one is at the end of the large intestine where the beginning of the anus is. Okay. Her anus is not here, obviously, but that's checking the valve that is at the beginning of the anus. Okay. Now we're going to check blood sugar this way. Blood sugar. Her blood sugar seems to be okay when we check with 3 fingers here on the blood sugar point. There's other points for other things. And then we're checking something called rib torque. So Yvette doesn't seem to have rib torque. Sometimes that irritates people a little bit when they're sensitive. Didn't bother her, but so we don't always do it with everyone. And then we're going to check some other things. We'll check protein utilization. Without a good source of protein, your skin is terrible. Have you ever heard anyone say, hey, you could benefit from some collagen or some other proteinous substance or hydrolyzed wheat protein or something like that? Even if you don't swallow it, you just put it, it's in like a skincare product. You know, collagen is a great protein. So people who don't eat enough protein tend to have trouble with their skin. You know, that's what causes wrinkles, is not having enough protein. Okay, so this is our expensive fancy lab we're doing here. We're just going to lightly pull on some hair and check to see if she's deficient in protein or if she's utilizing protein properly or not. And again, that circuit, these are like checking circuits of the body, and that circuit seems to be working properly. So, and I think your skin looks pretty good. Okay. Go ahead and lie on your back and we'll check a few other things out. Okay. These are psoas muscles. The psoas muscles are related to the kidneys, and the main nutrient of the kidneys is water. So we'll check the right psoas muscle, push straight up into my hand here, breathing. Okay, that psoas muscle is working. And then we'll check the left psoas muscle, push up here into my hand. And actually that left psoas muscle is not working quite right. So we could suspect that maybe that's water that's causing the psoas muscle not to work right. And if that's the case, then we could have, or if we thought it was the case, but we weren't sure, we could have Yvette drink some water, leave some water in her mouth, and then retest the muscle with the water in her mouth. You see how I'm talking to Yvette's body? You see how doing this functional physiology and functional neurology can be far more powerful and far more helpful to a patient than just doing a lab that showed what was happening to some extent 3 or 4 weeks ago? Because doesn't the body change from hour to hour, minute to minute, second to second, day to day, week to week, and month to month? And if the lab was done too long ago, wouldn't all those things change? I'm just wondering, because these are questions that nobody asked me before when I was trying to get help with my health. And the reason why I did get started as a chiropractic kinesiologist, as I am today, was because I was having trouble with my skin. That was the main reason. I had really severe acne, and nobody was really able to help me until I found this dermatologist, not a chiropractor, and they gave me Accutane, and the Accutane worked great, but it created all kinds of side effects for me. And it's no wonder that there's now class action lawsuits against the company that made the Accutane, and they changed their formulation, and then they were able to keep it out on the market, and more people got sick with the new, just don't even get me started on that. Don't even get me started. You've probably heard about this kind of stuff in the news and on TV anyway. So we've checked those psoas muscles. That could have to do with water. There's another thing we could check called cardiac low back, which comes from total body modification. Total body modification is a technique that was developed by a fellow named Dr. Viktor Frank. Here's the book, one of the books that goes over the technique. Okay, total body modification from Dr. Viktor Frank. And the company is now owned by a person named Kevin Millet. He's doing a great job with the company. Okay, so I'm putting my hands here on your body. Go ahead and push your legs straight up into my hand. Breathing. Okay, so that seems pretty good. Let's try it one more time. Push up here, breathing. Okay, then we could see if she has a hidden cardiac low back, meaning maybe her body's not telling the truth. Keep your elbows straight there. And push your legs up into my hand again, breathing. Maybe she wasn't ready, folks. Whoever's watching. Push your legs up in my hand again, breathing. Yeah, so as soon as she puts her hand up, the muscle gets weak, which is a sign of cardiac low back. That's a stress to the heart. And then now that our arm is down, let's see, try pushing up into my hand here, breathing. And then it's strong when her arm is down. Okay, thanks, Yvette. So, there's a lot we're finding out. We're finding out about the ileocecal valve. Troubles with digestion could certainly lead to skin conditions, right? Because most of the infections we get are in our digestive tract. That's why people get the common cold, is because they have a virus, a parasite, a bacteria, or mold, yeast, fungus, and or candida, or a provirus, or an amoeba, or a protozoa, or they have a spirochete, or something of that nature, and that pathogen is leading to all kinds of disruption to their immune system and releasing all kinds of poisons and toxins and toxoids, and those poisons, toxins, and toxoids are then causing the skin to erupt, okay? So the most common and easy to depend upon thing that would cause acne, sounds kind of strange wording the way I put it that way, but would be a virus. So a virus is the most common thing, but many things can disrupt the virus and make the condition get worse, and many things can make the condition get better. These are the most important things. Without enough water, for example, a person can't detoxify properly. And water is one of the most important things for healthy skin, because without eliminating the poisons and toxins, the poisons and toxins are reabsorbed in the blood, and the person ends up with trouble with their skin. It could be on the face, on the legs, it could be anywhere in the body. Okay, and what we can do to really find out what's the main organ or gland involved is figure out where the skin condition is. So, for example, let's say Yvette were to have a skin condition that went up the side of her leg here, and then it went back towards the buttock, and maybe along her side here, and then kind of even went over towards the back near her shoulder blade, and maybe she even has headaches along this side of her head. That's the distribution of the gallbladder meridian. So then we could know, hey, it's the toxic gallbladder that's leading to a lot of this trouble with the skin. You understand? These are the kinds of things your healthcare provider who's a dermatologist doesn't want you to know about, because they don't know about it. And if they did, they would be really helping you so that you didn't need them anymore, because you wouldn't need any kind of medication for your skin. You just have healthy, clear, glowing, vibrant skin that was supple as a baby's butt, like my skin was after I took Accutane. But that didn't mean I was getting healthy. My skin got better, but the Accutane had all kinds of side effects. And I'm so excited to bring you this information, by the way. This is really exciting. This is what got me involved with doing this kind of work. So let's check one more thing. We'll have you put a hand on your forehead, and then we'll just pull down on your arm and see if anything changes. Okay, nothing changed. So sometimes if people have a big emotion that they're dealing with, when they put the hand on the forehead, the hand touches the emotional points, and then all of a sudden the arm gets weak and you can identify the emotion, which is an interesting thing to do. Okay. So that's most of what I wanted to share with you. I'm so glad you're watching this, and again, you can just put your name and your email in the area below where you can do that, and then we can get in touch with each other and we can start helping you with your skin condition without the need for dangerous, toxic medications or really, dangerous procedures like surgeries or radiation or anything like that. Thank you so much.